Hello and welcome to the Imaging Wire Show. My name is Brian Casey. I'm managing editor of the Imaging Wire. We've got a great episode for you today. Our topic is new tools for diagnosing Alzheimer's disease. And our guests are Kevin Ullem and Saurabh Sharma of Siemens Healthineers. Kevin and Saurabh, thanks for being with us today.
Thanks so much for having us.
Great to be here.
So can you tell us about your backgrounds and about your roles at Siemens Healthineers? Kevin?
Yeah, no, thank you. So I've been with Siemens 23 years. I head our clinical development team in the MI factory. We have a host of new Alzheimer's tools and diagnosis. So excited to talk about that today and tell how Siemens can provide solutions for Alzheimer's.
Very good. Saurabh?
Hi, my name is Saurabh Sharma, and I work in the US MRI team. I'm very grateful to be here today. You know, Alzheimer's disease has impacted me personally, just as has many of you. And it's very fortunate to be working for a company like Siemens that's making an impact in the lives of patients suffering from this terrible disease.
Very good. So Saurabh, we all kind of know the story around Alzheimer's. You know, there's an aging population around the world. This disease is such a terrible disease. It's starting to become more and more commonplace, and it's becoming a major healthcare challenge, especially given, you know, the baby boom generation getting to this age where we're starting to see higher Alzheimer's prevalence. What's the magnitude of the problem, and how many people are projected to develop Alzheimer's in the years to come?
You're absolutely right, Brian. Alzheimer's disease is a horrible disease that impacts way too many of us. Currently in the US, 6.7 million Americans are impacted by Alzheimer's disease, and it's expected to double in the next few years. By 2050, it's expected that 13 million Americans will be impacted by this terrible disease. Alzheimer's disease is the 7th leading cause of death in the US, and it kills more Americans than prostate cancer and breast cancer combined. 1 in every 3 seniors dies from Alzheimer's disease or another form of dementia. You know, it's clear that early intervention, early detection of Alzheimer's disease is needed, and so are more treatment options. Thankfully, there are some exciting options that are available in the market today, and hopefully we'll get to talk more about those today.
Definitely, we're definitely going to do that. Kevin, can you talk about some of the challenges in diagnosing and monitoring treatment of people with Alzheimer's?
Absolutely. Diagnosing and monitoring Alzheimer's, it can be complex due to a range of factors related to the disease progression, symptoms, and the diagnostic tools available. So what are the challenges? Well, again, there's several. First off, there's early diagnosis difficulties. Alzheimer's begins with mild symptoms like memory loss or confusion, which can sometimes be mistaken for normal aging or stress. Second, there's a lack of a definitive test. No single test exists for Alzheimer's. Diagnosis relies on a combination of cognitive assessments, imaging tests, biomarkers, which may still leave some uncertainty. The only way to really definitively confirm Alzheimer's is post-mortem examination. Another is Alzheimer's symptoms can be overlapped with other types of dementia, such as vascular dementia or Lewy body dementia, which can make diagnosis more challenging. Sometimes advanced procedures such as PET scans and biomarkers are not accessible, particularly in low-income or rural areas. Alzheimer's also progresses gradually. Symptoms can vary greatly from person to person. Then you have the physiological impact on patients. Diagnosis can be stressful for the patient and their family, so there's a stigma attached to that. Another issue is Alzheimer's often occurs alongside other health conditions like cardiovascular disease or diabetes, which even complicates monitoring and management more. Now, the good news is, and there is some good news, that many efforts are underway to address these challenges and certainly reduce the stigma of Alzheimer's. So good news on the horizon.
Very good. Well, let's talk a little bit more about some of those therapies. Saurabh, what are some of the disease-modifying therapies that have become available? I mean, people have probably heard about Leqembi and some of these other things.
Yes, thanks, Brian. It's finally, there's some hope for patients suffering from this terrible disease in the form of disease-modifying therapies that slow the progression of Alzheimer's disease. It's still not a cure. It's important to understand that they're only slowing down the progression, and but that's still great news compared to what we have had so far. So the first drug that became available or clinically available was aducanumab or Aduhelm, which received FDA's accelerated approval in June of 2021. However, that drug has now been discontinued. The first disease-modifying therapy to receive full FDA approval for treatment of Alzheimer's disease was Leqembi or lecanemab, which received the approval in July of 2023. In July of 2024, a year later, second disease-modifying therapy came to market for the treatment of Alzheimer's disease called Kisunla or donanemab. Both Leqembi and Kisunla only work on patients that are in the early stages of Alzheimer's disease, also known as mild cognitive impairment. And that's really important because that stresses the need for early identification of patients suffering from Alzheimer's disease, so they could be put on these treatments and can benefit from these treatments.
Yeah. So so these treatments are now available. We're giving them to people who have mild cognitive impairment, very early stage. And it seems to me that imaging can play a really important role in trying to figure out whether a therapy is working. Is that the case?
Yes, absolutely. So when we look at imaging's role in monitoring these therapies, the role is twofold. Imaging is required not only to monitor the efficacy of the treatment, but also to monitor the side effects of these treatments. So we'll talk first about how imaging can be used to monitor efficacy of the treatment. So to be eligible for disease-modifying therapies, a patient needs to have built up of amyloid plaque in their brain. Currently, there are two FDA-approved methods for determining amyloid plaque in the brain. One is a PET scan or amyloid beta PET scan, and the other one is a spinal tap. The amyloid PET is preferred, of course, because it's both non-invasive and it has the ability to quantify the amount of amyloid in the brain. So the ability to quantify the amyloid plaque in the brain is crucial because now you can do scans over a period of time and understand whether the amyloid plaque in the brain is reducing or not, or in other words, whether the therapy is working or not. Now, it's important to understand, though, that the FDA requirements for doing a PET scan to determining whether the amyloid plaque burden is going down in the brain or not, it varies from one drug to another. For example, it's on Kisunla's FDA label that after 12 months, a PET scan be carried out to determine whether the treatment's working. But in the case of Leqembi, there is no such requirement. So, it's important to understand what's on the FDA's label and act accordingly. So now the second use of imaging in regards to monitoring is to monitor the side effects of these disease-modifying therapies known as ARIA, or amyloid-related imaging abnormalities. Over here, MRI is the imaging modality of choice to detect ARIA, and regular MRIs are recommended by FDA to monitor these patients or side effects on these drugs. ARIA in most cases is symptomless, and it only shows up on an MRI scan. So, but at the same time, it can be life-threatening. So it's extremely important that we scan these patients regularly on an MRI scan to monitor for these side effects. Now, the FDA recommended monitoring schedule varies from one drug to another. So for example, on Leqembi, it is required that an MRI be performed before the 5th, 7th, and the 14th infusion. Whereas for Kisunla, it's required that an MRI be performed before the 2nd, 3rd, 4th, and the 7th infusion. So again, it's really important to know the therapy, their FDA label, and follow all the protocols so that these treatments can be given to patients in a safe and effective manner. So in summary, treatment is used both for monitoring the efficacy of the treatment as well as side effects of the treatment.
So both modalities have a role in doing this. And it sounds like there have been recently some new software tools that are coming out that are available for monitoring ARIA. So I think that's something that probably a lot of clinicians will find helpful as well. Now, the reimbursement environment for using medical imaging for Alzheimer's has changed as well. I think that previously the CMS, the agency that administers Medicare, said they would only pay for one PET scan, but that's changed, correct?
Absolutely. So this is a very good question, since there have been a few positive changes or updates that should help with the broader adoption and access to these therapies. So, the first change should enable broader access to beta amyloid PET imaging, as you mentioned, which of course is important because PET is used not only for the diagnosis of Alzheimer's disease, but it's also used for determining therapy eligibility. So the change occurred in October of 2023 when CMS eliminated the NCD that restricted the use of beta amyloid PET to once per patient's lifetime. So what this means is that now local MACs or Medicare area contractors can make a decision at the locality basis whether they will pay for the drug or not. And so far we have heard good news, regarding that. Another change that CMS did as part of that NCD that was eliminated was CMS now no longer requires coverage with evidence development for beta amyloid PET scans, which again is a good thing because it reduces the amount of burden on the clinicians. The second positive change by CMS, which is currently in the proposed stage and hasn't been finalized, is CMS proposed plan for Medicare's coverage of PET imaging agents. So, it will let hospitals get paid separately for radiopharmaceutical portion of the PET scan. Historically, hospitals only get paid for the scan portion unless the radiopharmaceutical is in the pass-through status. But for that, for amyloid beta plaque, that has expired. So, if the rule is finalized, radiopharmaceuticals will get paid separately in the hospital setting, and hopefully that will increase access for patients to beta amyloid PET scans in the hospital setting. One of the important things, though, is that with every reimbursement topic, the policies vary between Medicare and private payers, right? And they also vary between different private payers, from one private payer to another. So it's extremely important for clinicians and sites of care to check with their own radiology benefit manager and their own insurance companies to get the accurate coverage information.
That's always great advice.
Yes. And then, but overall positive news in regards to reimbursement policies, and hopefully that should encourage adoption.
That's great. We don't always get positive news in radiology from Medicare, so it's really good to have that happen. So, Saurabh, what kind of solutions does Siemens offer for Alzheimer's diagnosis and monitoring?
So, Siemens is, very well positioned to add value and support clinicians and physicians and hospitals and other sites of care, in their journey to, provide care for Alzheimer's patients. So Siemens Healthineers offers a comprehensive portfolio of solutions that are designed to support the diagnosis, treatment, as well as management of Alzheimer's disease. Our portfolio includes imaging, radiopharmaceuticals, as well as lab diagnostics. So when we look at a patient's care pathway, a patient suffering from Alzheimer's disease, Siemens Healthineers can add value at every stage of the care pathway. When you look at the starting of the care pathway and you look at the screening, right, we can help support screening capabilities through widely available lab tests on our Italica platform. We have an extensive and constantly expanding menu of assays, which can help clinicians identify potential alternative causes for dementia outside of Alzheimer's. Then, moving one step forward in the care pathway, if you look at, the differential diagnosis and detection stage, we can support differential diagnosis with our Magnetome portfolio of MRI scanners. The soft tissue contrast of MRI and information gained from dedicated sequences enables the ruling out of other possible causes of dementia, including brain tumors, stroke, and other conditions. Every Siemens MRI scanner offers neuroimaging with end-to-end AI support, which includes AI-enabled guidance and workflow, AI-enabled acquisition and examination, and finally, AI-enabled processing and interpretation. Moving one step further in the care pathway, we can support amyloid assessment and therapy eligibility determination via accurate identification and quantification of amyloid plaque. every biograph PET CT can perform amyloid assessment required for Alzheimer's diagnosis and therapy eligibility. In addition, Siemens PETnet manufactures and distributes majority of beta amyloid and tau radiopharmaceuticals that are needed to perform PET imaging. And then lastly, we can support the detection of ARIA or the side effects of these therapies like we just talked. Every magnetom scanner is capable of performing the 3 key sequences that are required to detect ARIA, which are T2 flare, T2 star, and DWI. So in summary, Siemens Healthineers is able to support the provider community throughout the Alzheimer's disease patient care pathway, and we're extremely excited about it.
Very good. So Kevin, it sounds like the two modalities we're talking about here are PET and MRI. What are the strengths and weaknesses of each one of them for Alzheimer's disease?
Yeah, it's a good question because they're both key imaging tools in diagnosing and monitoring Alzheimer's. Each modality, though, has its own strengths and weaknesses. We'll start with the strengths of PET. PET can directly visualize pathological markers of Alzheimer's, such as amyloid plaque and tau. These are characteristic features of Alzheimer's, making PET a very effective tool for confirming a diagnosis. PET scans can also be combined with a qualitative analysis to measure the degree of amyloid or tau, which helps assess the disease severity and tracking progression over time. PET also has a high sensitivity and can detect Alzheimer's pathology even in the early stages when structural changes are not yet visible on MRI. So again, very strong, very good strengths for PET. Some of the weaknesses, however, PET imaging is not accessible in, as I was saying before, some low-income or rural areas. And not all hospitals or imaging centers have the infrastructure for amyloid or tau imaging, limiting accessibility. PET imaging does have radiation exposure. While it's low level, you are injected with a radioactive tracer, and it's normally combined with a CT. While, again, this exposure is generally safe, repeated scans can accumulate radiation doses. PET also provides less anatomical detail compared to MRI, which can make it difficult to precisely localize findings or assess structural brain changes without some additional imaging. So that's on the PET side. Let's take a look at the MRI. First, the strengths. MRI is detailed structural imaging. It provides high-resolution images of the brain structure, making it effective for identifying atrophy in key areas associated with Alzheimer's, such as the hippocampus or cortex. Unlike PET, MRI has no radiation exposure. So MRI does not involve ionizing radiation, making it safe for repeated imaging, particularly useful in long-term monitoring. MRI is also widely available and typically a little less expensive than PET, again, which makes it accessible for more patients, again, even in your rural settings. As far as weaknesses for MRI, it can have an indirect diagnosis. MRI can show brain atrophy and other structural changes related to Alzheimer's, but it cannot directly visualize amyloid plaque or tau protein, making it, again, an indirect diagnostic tool. It has limited sensitivity for early disease. In early stages of Alzheimer's, structural changes may not yet be evident, again, reducing MRI sensitivity for early diagnosis. MRI is also very sensitive to patient motion, so it can be challenging for patients with cognitive impairment who may struggle to hold still for long periods of time. One of the newer innovations is the combined use of PET and MRI in a PET-MR hybrid system. This leverages the strengths of each. PET provides the rich molecular information on Alzheimer's pathology, while MRI provides structural details, making them the perfect complement in both diagnosis and monitoring. These hybrid systems can combine both types of data in a single scan, improving diagnostic accuracy and efficiency. All in all, PET and MRI are two essential technologies when it comes to Alzheimer's imaging diagnosis, and I think their strengths definitely outweigh their weaknesses.
Yeah, sounds like it for sure. So, Kevin, can you talk about how PET and MRI technologies from Siemens Healthineers can add value to this process?
Absolutely. Of course, we offer both advanced PET and MRI technologies. All of our systems improve diagnostic accuracy, patient care, and operational efficiency in the diagnosis and monitoring of Alzheimer's disease. So how do we accomplish this? Well, let's start with PET. First off, we offer high-resolution PET imaging. High resolution is essential for detecting amyloid plaques and tau protein, especially in early stages of Alzheimer's. We also offer time-of-flight technology across our entire PET portfolio. Time-of-flight improves image quality by enhancing signal-to-noise ratios, which is particularly useful in detecting Alzheimer's biomarkers. We also offer advanced quantification tools. These provide objective data on amyloid and tau levels, again, across the entire platform. By allowing users to quantify biomarker levels, Siemens PET can help track disease progression and assess the effectiveness of disease-modifying therapies. We bring it all together then with our SingoVia software. This software solution allows for fast and standardized PET imaging and processing to assist with overall brain analysis. So that's on the PET side. Let's talk a little bit about the MR side. Like PET, Siemens MRI offers high-resolution structural imaging. This is essential in identifying brain atrophy and other structural changes associated with Alzheimer's. We can create detailed images which help differentiate Alzheimer's from other types of dementia, which often may present similar symptoms. Siemens MRI also does a stellar job with quantifying brain volume changes. This is useful for detecting early hippocampal atrophy and also tracking brain shrinkage over time, which provides an objective measure of disease progression. Siemens MRI also provides AI-enhanced imaging and quantification. Our AI-based tools such as AI Rad Companion can automatically detect and quantify brain changes related to Alzheimer's. And then we can bring all this together with our PET MRI hybrid systems such as our Biograph MMR. As I stated earlier, Siemens offers a combined PET MRI device which marries PET molecular imaging with MRI structural detail. This integration is particularly valuable for Alzheimer's patients as it provides both anatomical and molecular information in one scans. So just to quickly summarize PET and MRI's overall value in Alzheimer's diagnosis, we offer early detection, improved monitoring and disease tracking, enhanced operational efficiency, and we can certainly tailor our solutions to meet individual customer needs.
So most of the folks watching our broadcast are radiologists and neuroradiologists, but Saurabh, another key clinician in this process is the neurologist. So what's the best way to foster coordination between neurologists and neuroradiologists?
Yeah, Brian, this is a very important topic. And, especially so when it comes to monitoring ARIA or the side effects of these therapies. That's important because there are many pathologies that can potentially mimic ARIA. So it's very important for the radiologist or the neuroradiologist to know the patient's clinical history so they can order the right sequences and can diagnose accurately. Regarding ways to foster coordination, first and foremost, establishing clear channels of communication is critical. A neurologist needs to ensure that they provided the clinical history of the patient to the neuroradiologist. And then on the neuroradiologist side, it's extremely important that the results are reported back in a standardized format. Now, the neuroradiologist and the neurologist can work together. They can coordinate to build standard reporting templates that are agreed upon on both sides, or they can use templates provided by ASNR on their websites. They have some ready-to-go templates that they recommend, both neuroradiologists and neurologists should be using. And, I've seen in my experience that it's been extremely helpful for both the neurology community and the neuroradiologist community. And one of the other things, that's we have also seen is working and can help with foster collaboration is establishment of a multidisciplinary dementia board, which, it just helps bring together all the different stakeholders that are involved in the care of Alzheimer's patient, and it's crucial for them to come together. So those are some of the ways, but yes, you're right, that's extremely important.
Very good. Kevin, as we wrap things up, any other suggestions that you might have for radiology facilities in terms of setting up an Alzheimer's imaging service?
Absolutely. First off, you need to upgrade your imaging. Therapies are going to rely on imaging for diagnosis, treatment, and monitoring. Departments should assess if their current MRI and PET scanners meet the necessary technical specifications for amyloid and tau PET imaging, and certainly need to upgrade them if necessary. On that same note, prepare for an increase in imaging capacity and efficiency. The volume of PET and MRI scans is going to increase greatly as more therapies are implemented. Also, you need to develop specialized protocols for Alzheimer's. May need specific image protocols to detect amyloid plaques as well as tau protein and brain volume changes. Hire the right staff. Your radiologists, technologists, and support staff should be trained in neuroimaging protocols for Alzheimer's, including interpretation of amyloid and tau PET scans. They also need to stay current on advances in biomarkers and imaging agents. You should also plan for patient support and comfort. As you may know, many Alzheimer's patients experience anxiety during scans. You can prepare by developing patient-friendly environments and training the staff on managing patients with cognitive impairment. You may also need to offer sedation options. Last but not least, plan for some big data. Data storage and management is essential. Alzheimer's imaging studies produce large amounts of data. Departments may need to invest in higher data storage and PAC systems that facilitates easy comparison across time points. By proactively adapting in these areas, you can provide high-quality imaging services for all Alzheimer's patients.
Kevin, could you describe what kind of training is going to be needed for imaging departments to handle all these patients?
Yeah, setting up a specialized Alzheimer's imaging service requires departments to train staff on both technical and clinical aspects of brain imaging. Some key areas to consider are, first off, developing specific protocols for Alzheimer's. As I mentioned in the radiology segment, staff should be trained on specific protocols for amyloid plaque, tau PET, and a volumetric MRI. PET radio tracer handling, not to overlook the obvious, but you need training in the preparation of handling and administration of radio tracers. Also training in advanced MRI sequences. For MRI, training should include advanced sequences such as volumetric analysis for imaging hippocampal atrophy assessment and protocols like magnetization prepared rapid gradient echo, that's a mouthful, which is particularly useful for neurodegeneration studies. Also, training will be needed for the interpretation. Radiologists may need specialized training to interpret amyloid and tau PET scans, and also training on quantitative tools for assessing brain atrophy. Radiology staff should also have a foundational knowledge of Alzheimer's pathology, including understanding the clinical relevance of amyloid and tau biomarkers. They should also conduct regular multidisciplinary meetings and case discussions with neurologists, psychiatrists, and geriatricians, as these are valuable for aligning on diagnostic criteria and treatment implications. Last but not least, because Alzheimer's patients may have difficulty remaining still, technologists should be trained in techniques to minimize motion artifacts. So there's many considerations to take in from the training side. Make sure you do your homework before diving headfirst into Alzheimer's imaging.
Great. Kevin, any other suggestions for starting up an Alzheimer's imaging service?
Yeah, to kind of wind it all up, break it down to really 6 criteria. First, you need to invest in some specialized imaging equipment. As we've discussed, Alzheimer's imaging relies on PET and MRI scanners. Ensure the equipment meets the latest standards for neuroimaging. Second, again, as we've talked about, establish the right imaging protocols, standardize across your platform. Remember to hire and train skilled personnel. Can't say that enough. Radiologists, technologists, and support staff need to be able to understand and implement Alzheimer's-specific techniques. Implement quality control and standardization across your entire imaging platform. Consistency is crucial. Collaborate with multidisciplinary team, again, establish connections with your neurology, your psychology, your geriatrics, and then plan for financial and insurance consideration. And people don't take this in enough. They think if we build it, they will come mentality. Really need to work with insurance companies to understand coverage and reimbursement policies for Alzheimer's, and also considering offering financial counseling to patients and families. We, Siemens, also work with third parties who will pay the upfront cost of the PET or MRI system and provide risk-sharing alternatives. So that's another route a customer can take. By addressing all of these, you can provide high-quality specialized imaging that supports accurate diagnosis, timely monitoring, and effective coordination across the entire Alzheimer's pathway. So again, come to Siemens and we'll certainly take care of you from an Alzheimer's front.
All right, very good. Some great advice. So some great discussion today. I'd like to thank Kevin Ulm and Saurabh Sharma of Siemens Healthineers for being with us.
Thanks for having us, Brian.
Thank you so much.
You bet. Signing off for the Imaging Wire, my name is Brian Casey.